Treating a severe injury is only the first step really to a full recovery. The more intense phase often comes when it's time for rehab. Licking Memorial Health Systems is committed to seeing patients through from start to finish. So I'm happy, as always, to have CEO Rob Montagnes with us, along with Ben Broyles, who's their Director of Rehabilitation Services. So thanks for being here, guys.
Good morning. Thank you.
All right, so Rob, this is very much kind of a team effort. I feel like when you talk about rehab, you talk about resources. What kinds of things do you guys offer at Licking Memorial Health System to really provide that full recovery?
We really provide the spectrum of rehabilitation services. I think a lot of folks may be coming out of the winter if they've had any injuries through the shoveling or snow blowing, and we're getting into maybe outdoor exercise activities. My son, through football season, unfortunately needed our services. Any of those types of injuries can lead to rehabilitation, and we have the full gamut of services. I think for certain folks, our physical therapy, once again thinking of my son, working with physical therapists on rehabbing maybe a knee injury, something of that nature, but more significant rehab. If folks have had more significant orthopedic surgery, perhaps a stroke, and they need some maybe 10, 12, 14-day inpatient rehab services, we have that available as well. So whatever rehab they need, the majority of those we have available right at Licking Memorial.
And it's important to note that you mentioned your son, because this is something that people need at all different times of their life, any ages. It's not just you think of maybe an elderly person who injured themselves. I mean, this is athletes, this is kids, this is adults. So Ben, let's talk about kind of some of the injuries, some of the surgeries that then lead to that more extensive rehab that some people need.
Sure, absolutely. You know, really, to your point, we run the full gamut. Regardless of whether it is a significant trauma event that has occurred that requires considerable inpatient rehabilitation, to Rob's point. Inpatient rehabilitation, you know, the requirement is 3 hours of tolerance of therapy per day. And so we can, you know, provide that service, as well as if you are candidate for a total joint replacement, such as a knee or a hip replacement. A lot of those procedures are being done on an outpatient basis. That's the direction that the environment is heading, and so they may receive services in our outpatient venue or even in our home care services. If a patient isn't quite able to make it to an outpatient therapy center and they are homebound, then they are eligible to receive home care services. So that's another service line that's available that the rehab services provides care in and is part of that clinical team.
Yeah, that's interesting to note too, because that is a lot of situations, I'm sure, for people having any kind of severe surgery or injury. And I think the other thing, just saying that, you know, you have all these different therapies. You mentioned, you know, you have to have 3 hours of tolerance, as you put it. Rehab can be very difficult for a lot of people. So I think it's important to note that you have kind of all these different options as people are healing, right?
Mm-hmm. Sure, absolutely. Rehabilitation services really is a complete clinical team of skilled individuals, different disciplines. The therapy discipline that people are most familiar with is physical therapy.
Sure, you hear that a lot.
Absolutely,
yeah.
And it's the physical therapists that really are the mobility experts. They're the individuals that can analyze an individual's gait pattern, which is the ability to walk or to run. They've got a lot of knowledge and range of motion of joints and muscles and nerve innervations of the different muscles. So they can really break down an individual's you know, deficits and see where they're at, what needs addressed, and really develop that plan of care. Two other disciplines that you know that aren't as familiar to a lot of individuals are occupational therapy and speech therapy. Occupational therapists, they really focus on function. They are the experts in the ability to break down a task and identify what's going to be the best way to address that deficit within that task. And we're talking things as simple as basic activities of daily living, like bathing, dressing, feeding yourself.
And yeah, it's important to note that all falls under this kind of category. And Rob, you're always looking for kind of new technologies. You know, quickly, is there anything new happening with you guys as far as that?
Yeah, we're very pleased, specifically with the rehab, physical therapy rehab. We have T-Rex, not the dinosaur, but it's a resistant band, and it helps with the ability to use the body as your resistance, but not be as difficult or hard on the lifting and the motion. That's a new physical therapy tool and technique that we have available that not very many hospitals have. So once again, we're always trying to push the envelope in terms of the technology or the clinical techniques that we use, and that's another good example.
Yeah, all of this obviously benefits too to having a community hospital, having all this available in your own backyard is always incredible to hear. So gentlemen, I want to thank you so much for being with me.
Thank you.
Thank you.